Hey guys, welcome back to Stacking Stocks as we analyze the latest information regarding Neuralink. Okay, so there are these reports that Neuralink is still on track for the first human trials. Elon Musk shared a few updates on Neuralink, including that the company is still on track for human trials by the end of 2022. So stay tuned for more information on the Neuralink. But before we kick it off, please like, share, and subscribe to our channel. We certainly appreciate the support and time. Thank you so much. Now, back in February 2021, Elon Musk revealed that Neuralink was working super hard to make its brain implant safe. He also stated that Neuralink was closely communicating with the FDA to start initial human trials later that year. However, 2021 passed with no human trials. Earlier this year, Neuralink opened jobs for a clinical trial director and clinical trial coordinator, which suggested that the company is closer to testing its device on humans. So basically, it looks like Neuralink is fast-tracking its human trials for this year. Musk's company is in the process of hiring a clinical trial director, which indicates that Neuralink could soon begin clinical trials with humans for the device. The trial director position involves working with the most innovative doctors and top engineers to oversee Neuralink's first round of clinical trials, according to the job listing. The company's mission is to develop brain-machine interfaces that treat various brain-related ailments, with the eventual goal of creating a whole brain interface capable of more closely connecting biological and artificial intelligence. Recently, Musk noted that Neuralink might be able to address morbid obesity. The first time Musk broached the topic was during his TED interview with Chris Anderson. He told Anderson that Neuralink would focus on solving brain and spinal injuries within the next decade. Well, everything that Musk always comes up with is nothing short of amazing. Neuralink is simply working on bridging broken links between the brain and the body. Neuralinks in motor and sensory cortex riding past weak or broken links in the neck or spine to the Neuralinks in the spinal cord should theoretically be able to restore full body functionality. Musk also told Anderson that the Neuralink device could address health conditions like morbid obesity in the long run. Professor Andrew Jackson from Newcastle University and an expert in neural interfaces noted that Musk's claims about Neuralink are probable. Jackson specifically stated that Neuralink implants are less invasive than other morbid obesity treatments. So in a nutshell, this isn't just a wild dream. We're talking about another Elon Musk breakthrough. Now, Musk computed Neuralink's main focuses required to reach its current goals. He noted an electronics, mechanical, and software engineering problem with the Neuralink implant. The Tesla and SpaceX CEO compared the problem with the complexity of a smartwatch, which he admitted is not easy. Musk invited anyone who has experience in engineering and manufacturing smartwatches or phones to join Neuralink because their skills are directly applicable. He also highlighted that Neuralink is in the midst of developing its surgical robot, which is essential to linking the implant with the brain. Musk noted that the surgical robot is comparable to a state-of-the-art computer numerical machine, which is commonly referred to as a CNC machine. While the patient may not be awake to see the machine in action, it was still important to design a non-intimidating robot that can aesthetically live alongside the iconic machines in Musk's portfolio. Neuralink's bot features clean, white, arcing lines and smooth surfaces for a look that at once flags its advanced technical capabilities, but also contains some soothing and more approachable elements, which is wise considering what the machine is intended to do. The Neuralink surgical robot can be separated into three main parts: the head, the body, and the base. The head of the robot is that helmet-like piece, which actually holds the head of the patient. It also includes a guide for the surgical needle, as well as embedded cameras and sensors to map the patient's brain. The intent of the design of this piece, which includes a mint-colored interior, is to give the robot an anthropomorphic characteristic that helps distract from the invasive nature of the procedure. There are also single-use disposable bags that line the interior of the helmet for sterile operation. The Neuralink procedure is quite complex, and that's why the company also developed a surgical robot. But then with the clinical trials coming up, it's also necessary for us to understand how this Neuralink will work. So be sure to keep watching as we unravel that part. So according to a 2021 Neuralink video, The company's brain implant consists of a puck containing the secret sauce of active electronics and flexible electrodes that are around 50 microns wide, 5 microns thick, and 20 millimeters long. The electrodes attached to the puck were often referred to as threads in the video or compared to hair strands. The electrodes are also very fragile. The BrainChip startup had released footage appearing to show a monkey playing a simple video game after getting implants of the new technology. The video's voiceover explained that Neuralink works by recording and decoding electrical signals from the brain using more than 2,000 electrodes implanted in regions of the monkey's motor cortex that coordinate hand and arm movements. It's currently unclear where Neuralink is in their trial process, Bloomberg reported. Typically, clinical trial directors are hired early on in a company's interactions with FDA to help maximize the chances of FDA approval. In 2020, Musk said that the startup had secured breakthrough device designation from the U.S. Food and Drug Administration. While this doesn't imply approval, the designation can speed up the regulatory process for high-potential medical devices. In the long term, Musk hopes that the Neuralink devices will enable people to achieve superhuman cognition, which is an achievement that may alleviate Musk's own fears about AI superiority. The company's first product, the N1 Link device, is an implant that transmits data via a wireless connection. Musk said that he's optimistic about the potential for Neuralink and its progress towards beginning human trials at the Wall Street Journal CEO Council Summit. Before understanding how Neuralink works, it's necessary to comprehend the science behind the human brain. You see, the brain consists of neurons that transmit signals to cells in the body, including muscle, nerve, gland, and other neuron cells. Every neuron is made up of 3 parts called the dendrite, the soma, and the axon. Each of these parts has its own function. The dendrite receives the signals, the soma processes these signals, and the axon then transmits the signals to other cells. The neurons are connected to one another by the synapses, which release neurotransmitters. These chemical substances are then sent to another neuron cell's dendrites, causing the flow of current across the neurons. The electrodes that are part of the Neuralink will read electrical signals that are produced by several neurons in the brain. The signals are then outputted in the form of an action or movement. According to the company's website, the device is implanted directly in the brain because placing it outside of the head will not detect the signals produced by the brain accurately. Now, what does Neuralink actually do? Well, Neuralink can be used to operate encephalopathy. It can also be used as a connection between the human brain and technology. This means that people with paralysis can easily operate their phones and computer directly with their brain. Its main purpose is to help people to communicate through text or voice messages. Of course, Neuralink isn't just limited to that. It can also be utilized to draw pictures, take photographs, and do other activities. While hooking a brain up directly to electronics isn't new, doctors implant electrodes in brains to deliver stimulation for treating such conditions as Parkinson's disease, epilepsy, and chronic pain. In experiments, implanted sensors have let paralyzed people use brain signals to operate computers and move robotic arms. But Musk's proposal goes way beyond this. Neuralink wants to build on those existing medical treatments as well as one day work on surgeries that would improve cognitive functioning. Now, Elon Musk is one of a kind as he never ceases to surprise us. But do you think the Neuralink brain chip will be a success? Let us know via the comments section. Thanks for tuning in today. Stay safe, and we'll see you next time.